Fever is defined as a temporary rise in body temperature above the normal range, typically caused by an underlying condition such as infection, inflammation, or illness. Fever can be classified into different types based on its pattern and duration. Based on pattern, we have intermittent fever, where the temperature returns to normal at least once every 24 hours. Examples include malaria and sepsis. Remittent fever fluctuates more than 1 degree Celsius, but does not return to normal, and is common in endocarditis. Continuous or sustained fever remains elevated with minimal fluctuations and is common in bacterial infections. Undulant fever involves a gradual rise and fall of temperature over weeks, often seen in brucellosis. Relapsing fever is characterized by recurring episodes of fever separated by periods of normal body temperature, most commonly caused by infections with Borrelia species. Based on duration, acute fever lasts less than 7 days, such as in viral infections. Subacute fever lasts 7 to 14 days, seen in subacute infections or some chronic diseases. Chronic fever lasts more than 14 days, common in tuberculosis, autoimmune diseases, and malignancies. Temperature varies at different parts of the body. Postoperative fever is defined as a temperature higher than 38 degrees Celsius on 2 consecutive postoperative days, or higher than 39 degrees Celsius on any postoperative day. The causes of postoperative fever are categorized into infectious and non-infectious origins, often remembered by the quote, 5 W's mnemonic: wind, water, wound, walking, and wonder. Wind relates to pulmonary causes, typically occurring within 1 to 3 days post-surgery. These include atelectasis, pneumonia, and pulmonary embolism. Water relates to urinary causes, typically 3 to 5 days post-surgery, often due to urinary tract infection from Foley catheterization. Wound is for surgical site infection, commonly 5 to 7 days post-surgery, involving superficial or deep infection or abscess formation. Walking refers to thromboembolic causes, 5 to 7 days post-surgery, including deep vein thrombosis and pulmonary embolism. Wonder drugs refers to drug-related fever, which can occur anytime post-surgery. Causes include reactions to medications or malignant hyperthermia. This slide illustrates the pathophysiology of fever. Postoperative fever can be classified based on timing, cause, or pattern. Based on timing, immediate postoperative fever occurs within 24 hours due to surgical trauma, blood transfusion reaction, or malignant hyperthermia. Early postoperative fever occurs within 1 to 3 days, potentially caused by atelectasis, aspiration pneumonia, or pre-existing infections. Intermediate postoperative fever occurs 4 to 7 days post-surgery, linked to surgical site infection, urinary tract infection, or deep vein thrombosis. Late postoperative fever occurs more than 7 days post-surgery, typically due to abscess formation or persistent wound infection. Based on cause, fever is classified as infectious or non-infectious, resulting from factors like drug reactions, tissue trauma, or thrombosis. Based on pattern, fever is either low-grade, often seen in tissue inflammation, or high-grade, indicating severe infection or systemic inflammation. Investigations for postoperative fever include a complete blood count, blood culture, CRP, ESR, ABGs, urine tests, chest X-ray, and wound swab for culture and sensitivity. Further investigations include Doppler ultrasound, CT scan, lumbar puncture, blood smear, and ECG. General management of fever involves monitoring vital signs, administering antipyretics for comfort if the fever is high, and ensuring adequate hydration. Treatment also requires addressing the underlying causes of the fever.